Hey everybody, thanks for joining me here and thanks for checking out my podcast. Don't forget to subscribe to my YouTube channel and click the notification bell for new episodes. You can also find Shine Without Shame on Spotify and Apple Podcasts. Today my guest is Katso Kangwana. Katso is a licensed clinical social worker specialized in the treatment of trauma. She is a practitioner of rapid resolution therapy, a method that integrates the emotional and rational systems of the brain to rapidly and effectively heal emotional pain. Since 2011, she has used rapid resolution therapy with clients to heal anxiety, anger, phobias, guilt, shame, and trauma caused by sexual, physical, and emotional abuse, parental abandonment, accidents, the loss of loved ones, and the diagnosis of debilitating diseases. Katso is also trained in eye movement desensitization and reprocessing, or EMDR, and accelerated resolution therapy, ART. When she is not working with clients in a therapeutic setting, Katso gives workshops and talks on authentic relationships and spiritual development. Katso also has a passion for supporting women through coaching on navigating life's big questions, including identity, purpose, and the meaning of challenges. Katso's first career was in wildlife conservation, and she has a PhD on human-elephant interaction from the University of Cambridge. She has also lived in Kenya, England, and the UAE and the US, and welcomes clients of all backgrounds. Katso, it's so nice to have you. Thank you.
Thank you so much for having me, Tiffany.
Yes, of course. I thought that you and I would have a really interesting conversation given your work, and I'll just share with the audience that we did meet online, as so many people I'm sure have in this last year and a half, 2 years, but we are part of a women's gathering on Zoom. And it's been quite a journey personally for me. And I know it's been such a dynamic experience to be connected to so many amazing women from around the world and hear about their experiences and their challenges and what they're learning about life and themselves in this, ever evolving world. So I appreciate that connection that we have.
Yeah, I've so loved being part of that sister net. It's such a rich and authentic sharing, and everybody brings themselves to it fully. And it's really been the highlight of my weeks through the pandemic.
Likewise, yes. Well, I would love to hear more about this transformational work that you're doing, working with clients as they work through their trauma. And I would love to know more about this therapy because it's the first time I've heard about it since you shared it with me. And it'd be really interesting to know how you are approaching trauma and healing and one of these tools that you're using, what that's doing for people's lives. So please say more if you would.
Thank you, Tiffany. And I really appreciate creating this space to talk about, shining without shame. And so my work, like you said, I specialize in the treatment of trauma. And so my most frequent encounters with shame are trauma-induced shame, or the shame that comes about as a result of having experienced traumatic events such as, emotional abuse, sexual abuse, physical violence. And that kind of shame is definitely on the side of maladaptive shame, and something that needs to be cleared in order for mind to work well and for someone to feel a sense of well-being. And so of the modalities I'm trained in as a therapist to deal with trauma, I really find most effective and enjoy working with rapid resolution therapy because it allows one to clear trauma rapidly and painlessly for the client. And in that work, I found that it's also very supportive of the clearing of shame. And so, rapid resolution therapy, I encourage everybody to look it up. The website is rapidresolutiontherapy.com. If one is in need of help to process trauma or shame or any other, disturbing emotion, find a rapid resolution therapist near you. And, thinking about this particular approach and how it would address shame, which is, I know, the main topic of our meeting, is that the rapid resolution therapy way of thinking about shame is to frame it as a preoccupation. So something that prevents the mind from being clear and dealing with life in a way that one is present. And also thinking about shame as the meaning that one has attributed to a traumatic event.
And people who are working with you and who are trying to move through the pain and the experiences that they've had that are preventing them maybe from fully living their lives with joy and
Mhm,
being free to
mhm.
move forward. Do you find that most people want to get away from shame? I mean, in other words, depending on when you've had a traumatic experience or when are when you what the experience was, I guess I wonder, sometimes it might be so much a part of your life and your identity in some ways that even if it doesn't feel good, it may just be something you're comfortable with, oddly. I wonder, in your experience with this work, do you find that the human like human nature, that most people don't really want to live in shame or to feel shamed? Like, in other words, is it once you realize, wow, okay, yeah, I've been holding on to this. This is definitely distracting me and keeping me from moving forward. Do most people want to just let it go, or is it sort of an odd relationship where maybe you've gotten so used to it and so comfortable, or maybe it's even embedded into your you know biochemistry and so deeply inside you that it may not actually be something that people want to let go of? I wonder, just curious what you've experienced in that
It's
work.
such an interesting question and point. And I'm so glad you brought it up now because what I found is, in my work with trauma, and I think this is the general experience of, experts working in trauma, is that shame is tends to be hidden. So it can make the work of a therapist a little tricky, and it certainly can make an individual's approach to therapy and what they're seeking for also tricky. And so, just thinking about how we define shame. So, shame is, an experience that has some thought piece to it or cognitive piece to it, and then an emotional component to it. And it's really about a negative um, attribution around the self. So, a negative self attribution. And so, when one is feeling shame or experiencing trauma-induced shame, the attribution around self will be that I'm broken or that I am flawed, um, I'm not lovable, there is nothing good about me, I'm a bad person, right? But, when I mentioned that, trauma can be hidden, I've never had a client come into my office saying that I'm struggling with shame. You know,
Hmm.
they will come in and they will say, something terrible happened to me. Maybe I was raped. Maybe I had an abusive relationship over a long time, or, I had a difficult childhood. And they would never be leading with, I'm really struggling with shame. But as we unpack, what there is for us to work with from an RT perspective. One of the things, I'll share my experience sort of developing as a therapist. So I've been in training with Dr. John Connolly for, since 2011. And as I was learning this method, I would notice that I wasn't getting quite the results and transformations that he's getting. And, so I would keep doing trainings and trying to learn this approach. And within a little span of time, I started to realize that he had a definite sequencing to how he was approaching somebody's difficulty. And what I realized that, before he even understands all the details of the traumatic experience, he would address the shame or the guilt that's associated with it first, because the shame and the guilt can create a roadblock to clearing the traumatic memories. So, and then I noticed, having sort of started to think through that lens, and think through things from the RT lens, asking about, is there any shame or guilt associated with this particular disturbance? Or, asking, well, when you think about that experience, what is the emotion that you feel? And someone might at that point say shame. And then working to clear that before I even know much of the detail about the traumatic experience, clearing the shame or the guilt would then make the clearing of the trauma so much easier. So, I think shame is one of those emotions, cognitions, experiences that can mask itself, or that we can mask, however that works, as a number of different things. So perfectionism, anger, rage, anxiety can all be driven or centered around a sense of shame. So it's trickier to find, and it's never something that someone leads with in terms of, I'm coming to therapy to deal with shame. Does that answer your question?
Oh, yes.
Yeah.
Absolutely.
Yeah.
That is interesting. I didn't have an answer in my head, like what
Okay.
an expectation of what you would say. So I'm fascinated. I'm more fascinated now with this concept. And I'm also curious about trauma. And I know that you tend to focus on healing from more specific, maybe more egregious, like traumatic experiences. But in the culture, in our culture, at least in the States, I can say there seems to be this idea that, well, in general, that certain words, that words are used in pop culture, but sometimes people don't always really know the origin of the word, or they start to use it for so many, to describe so many situations or realities that maybe it gets overused. I guess that's what I'm really trying to say. And the word trauma is coming up more, I notice, in everyday parlance, like everyday conversation and pop culture. And I've been thinking about this for a while. Are we overusing the word trauma? In other words, when someone has an experience, maybe it's not physical violence or abuse or neglect, but there's something that they experience that takes away part of their light, or takes them off course, or keeps them from really being happy, or even living with joy and thriving. Is it possible that trauma can be smaller scale experiences, but still have a profound effect? Or people overusing trauma, and I'm not that we need to judge people's use of the word, but I think I'm trying to be more supportive of understanding trauma and trying to help other people recognize what trauma really is about. Is there something that you could explain that will maybe help us explore that a bit?
Yeah. So, I mean, we have, of course, a diagnosis, post-traumatic stress disorder, right?
Mm.
And in order to diagnose somebody with that, we would, there are a specific set of criteria and symptoms that they would have. And, there's a timeline in terms of when the event occurred, when the disturbance is felt. And then, so, that's one place that we see, trauma used. In our common speak, I think people talk about trauma and can mean, both big T traumas, bad things that happen to people like abuse, sexual violence, accidents, all of those pieces. But then there's also the idea that there are small T traumas. So small T traumas are, um, really traumas that are less about what happened to a person and more about what may not have happened to them, or what needs haven't been met as they were developing.
Mm.
So it could be that, one was, abandoned as a child or neglected as a child. Their needs weren't fully met. So there've been a series of things that have happened that have accumulated over time to contribute to somebody not doing as well as they might. So, that there's a difference there. With the rapid resolution therapy lens of looking at things, one of the things that I find particularly empowering for both the therapist and the client is that, or we call them like a participant, and the therapist is a facilitator in the rapid resolution therapy diet, is that we think of disturbance as a problematic way that mind is processing information.
Hmm.
And so, most people would look at a situation and say, oh, that person was attacked, therefore they have trauma, right? Or, someone was abusive, therefore you have trauma. And that's one way of looking at it. That's not a problem. But if we look at it instead of, it's not necessarily what happened that's causing the disturbance, but the way mind is processing information about it, then from an RT perspective, that gives both the clinician and the client much more power to affect change, because all then there is to adjust is the problematic way that mind is processing information.
Hmm.
And so I tend to, I do say I'm a trauma specialist, but, when I'm thinking about it, I'm thinking about disturbance. So not necessarily a diagnosis of trauma, or, whether it's a small T or a big P, because, people can experience the same negative event and have very different outcomes. Someone could, meet the diagnosis of PTSD and someone might not. So it's really about, what are people noticing that is causing some disturbance, and then how do we clear it is sort of the approach that I take. How do we make them clear to move forward with their lives in a way that
Okay.
is for the greater good for them and for everybody else?
Right. So when people say, "Oh my gosh, I think I have PTSD," like maybe they were spoken to in a way that was like disrespectful or demeaning
Mhm,
at a store,
mhm, mhm,
but it was
mhm,
really disturbing to them in
mhm,
a way.
mhm,
And
mhm,
but they may sort of, casually, semi-casually say, "Oh, that situation. Oh my gosh, I'm like still recovering. I have like
mhm,
PTSD from it."
mhm,
So
mhm,
possibly, I guess on some scale, maybe they
mhm.
do have a little PTSD. Is that true based on, the idea of disturbance, or am I not really understanding disturbance, what disturbance means? Maybe.
So, you know, I prefer not to think about it in terms of the diagnosis,
Mm.
but if that person felt that that experience was disturbing at the time and is continued to cause disturbance over time, right? And so they were to step into the office of anybody who does rapid resolution therapy, but also myself. I would approach it in terms of, Well, when you think about the event now, right? And I would ask them, like, think about the event now, and do you feel some of the disturbance that you've been feeling? And they might say yes, right? And so, or I might say, think whatever it is you need to think to cause the disturbance, right? And they would do so. And so, what's happened in that particular interaction is I've asked them to cause from their conscious mind, to think whatever they need to think to cause something to go on below conscious awareness to cause the disturbance, right? So then that becomes the starting point, because then I can say to them, like, okay, so you were very cooperative. I asked you to do this thing and you did it. And so what we can say from there is that what's causing the disturbance is the way mind is processing information, right? You were able to think something logically that caused the disturbance logically. And so what then there is for us to clear is a problematic way that mind is causing that disturbance, the problematic way that mind is processing information to cause that disturbance. And so then the RT protocol allows me to guide, like Dr. John Connolly came up with this beautiful way of guiding the client through an experience that would clear the emotional charge of that memory, right? And if we were to think about, my screen as the mind, this would be the incoming and that would be storage. And so that traumatic experience might be sitting here and mind is just sort of, waiting to respond to everything from that, the emotional charge of that. So what we do is we move that over into storage. So it's remembered, but it doesn't have the charge that it had before.
Okay. Okay. And I think also what I'm trying to do is, because some people may never use this therapy, but they may want to just understand a little bit more about
Sure.
trauma. So I'm trying
Yeah.
to, I think, also explore in my mind, like, well, PTSD is sort of a word that everybody uses now. And I'm not trying to be flippant. I
Yeah.
guess I'm just wondering how much of trauma and just the general kind of speak of life is real, and how much of it is maybe just something else, something like, emotional distress, or, a sense of disempowerment. I guess
Mm.
that's what I'm also really curious to explore. If you're willing to sort of step outside for a moment of the therapy process, which sounds
Mhm.
incredible and it sounds
Mhm.
valuable,
Yeah.
but maybe for those who aren't going to ever use it, although
Mhm.
I encourage people to use all kinds of resources and tools. So
Mhm.
I hope that those who are called to it do use it. But for those who
Mhm.
maybe just won't, or don't have access, or don't have
Mhm.
the resources,
Mhm.
how can we maybe look at trauma in a way that it maybe it's a spectrum, but like, where does the point come where you really do need help? You need, some sort of professional guidance and treatment. And where is it maybe that it's trauma, but it doesn't necessarily require like treatment? And how can people kind of navigate through that for themselves if they aren't maybe necessarily needing treatment? Does that make sense, what I'm asking?
Yeah, it does, but it's a
Mm,
very subjective, how do I say, experience, right? Because,
right.
like I said, one individual with the same experience wouldn't experience trauma, the other would. So it's your own evaluation of, to what extent is what I'm experiencing getting in the way of me moving forward with my life in a productive way, right? And you can seek help from, make connection with people around you, talk through it, reach out to somebody. Sometimes it may be that you get a little bit of help from a professional, but it's really a very subjective decision. That's the word I was looking for,
Mm,
in terms of when to reach out for help. Something that I might add here that I think might be helpful to, sort of understanding this is, if something disturbing happens, right? And it could be as small as, in third grade, your teacher, was upset with you because your socks weren't pulled up the right way, or, or
mm,
Um, what happens, okay, so we have two kinds of memories, right? We have what we can think about, what we call implicit memories, and then explicit memories. So explicit memories are memories that we can remember, we can talk about, they're not charged, and it would be most of our memories about our childhood or events that happened. But implicit memories are ones that are sort of have emotional charge, and they're more like a felt experience. So when that memory is brought up, there's sort of an emotional experience, a somatic experience of that memory. And what that usually tells us is that that memory is not being fully processed, right? And the reason it wouldn't have been fully processed is because when the disturbing event happened, the amygdaloid system of the brain takes over, right? So what it does is it prepares you, gets you alert and motivated to deal with whatever's disturbing, either by fighting or running away, right? So that's how the brain functions at that time. Because the amygdaloid part of the brain is prioritized, there are parts of the brain that go offline. So some things like the hippocampus and the prefrontal cortex go offline, and those are the parts of the brain that would put a memory into context and timeline. And so what happens is then we have this memory formed without a context or a timeline. And then in the future, whenever that is, anytime that memory is accessed, what's actually happening is that it's almost as if the brain doesn't know when it happened and how it happened. So the brain experiences that memory as if it's happening in that present moment. Right. And so, and it creates the emotional response to deal with that thing that the memory is about at that time, right? And so when we say we're clearing trauma, or we're treating trauma, all of the methods that do that effectively actually engage the mind in the process of taking that implicit memory and putting a timestamp and a context stamp on it so that it's stored and it's remembered, but it doesn't create this emotional charge when it's recalled, right? So what rapid resolution therapy does is it allows the therapist to actually do that in a very beautiful way. There was some research done in the 90s on, can you unlearn fear? And this was through experiments with mice and extinguishing of memory. And what they found is that when a memory is recalled, there's a window of about between 3 to 5 minutes after recall and about 5 hours, in which the memory is malleable and it can be updated, right? And so what EMDR does, what rapid resolution therapy does very effectively, and a number of other therapies that deal with trauma, is that they update the memory within that reconsolidation window. So the process is called memory reconsolidation. And so as I was describing with rapid resolution therapy, we pick up the memory. I, as a facilitator of RRT, have a lot of control in terms of how much recall, and we never do that unless there's a good connection between the clinician and the client, and that the clinician or myself, if I'm doing it, is assured that the amygdala of the client is in a very calm place. So then we open that memory. So I do a number of things to facilitate that. And we open the memory. I can guide in terms of how much or how little. through that process, as we open the memory, I do a number of things that are taught in the RRT process that allow the client to look at that memory from a different perspective. So look at it from the present sometimes, go back, look at it from a different angle. And in doing that, what we do is we're creating what we call a mismatched experience where, one is in the memory, not in the memory. Right. And it's in that experience, the mismatched experience, that memory is updated and the brain knows, oh, that's no longer happening. And once that has happened, then the memory moves over into storage. So, it could be as small as, when I was 6, I'm giving a couple of examples of things I've dealt with in my office. When I was 6, I was walking to lunch and someone vomited in front of me, right? And then that becomes a big fear of vomiting for the rest of one's life. Or, it could be that, I was walking down the hallway and some people in high school were teasing me, and then that has been held for a number of times. So, whatever memory it is, whether we would consider it a big trauma or little trauma, if it's caused disturbance, it's worthy of just having mind updated and rebooted, as it were. Does that make sense?
That makes sense. Yeah. And I remember a little bit from my undergraduate psychology program, but it is incredible to know how much knowledge and through research, through treatments and development of treatments, we understand the brain and can manipulate the memory center. It's incredible.
Yes.
That we're at a place where and I know there's still more to learn, but where we can actually affect someone's life by simply, powerfully. I understand it's a very particular technique and process that you learn, but it's incredible that it so simply, in a way, it can change someone's life simply by how they relate to a memory. It's incredible. Yeah. And so
and I find it's very humbling to be in that space and to be actually watching real time as someone discovers, oh, I've never been broken, or, oh, that was just the way my mind was reading that and I'm totally okay. And so sort of restoring to wholeness is really, I think, the goal in terms of moving beyond shame and trauma.
Yes, restoring to wholeness. Yes, absolutely. And I know that there are so many resources or just tools. I put some of them in quotes, maybe, or sort of air quote tools in a way, because I know for some people, they really explore. They explore a lot of different resources to heal traumatic experiences. I don't know the efficacy of some of them, like when people go into these, really deep, I don't know if it's, I don't even know what the language is, but when they take substances that get them to a state where they're sort of in a trance, and, there's all kinds of a number of substances, but there's also, in like a clinical sort of setting, I've been learning about, like therapy guided, and I don't, off the top of my head, I can't articulate exactly what it is, but it is related to dealing with trauma. But people take a certain substance that gets their brain to a certain place, and then, and they're monitored, for 24 hours or however long. I'm sure you're familiar. I just wanted to articulate it as best as I could for everybody listening and watching, but it is interesting. But I also wonder, do you have any opinions about the different types of approaches people take, not from a sense of, judging, but are some, in your opinion, more effective, even if maybe you haven't worked directly with some of these processes or resources that people are exploring in terms of dealing with trauma, getting themselves to a place where they feel like they can safely address traumatic experiences? Or do you think some work better than others? Are you aware of Are you aware of, processes that are really effective, like the one you use in addition to that? I'm just curious because it's kind of becoming part of the culture. People are starting to take all these kinds of pathways. Does that make sense what I'm
Yeah.
asking?
And I think what I've noticed is that the pathways that are effective are usually approaching things in a similar way. So
Hmm.
this idea, this discovery that, oh, there's a memory reconsolidation window, um, is a critical piece of how one supports the brain to do that, right? And so there are different effective modalities that do that. I'm trained in a few.
Hmm.
um, I will say that I do believe that rapid resolution therapy is probably the least painful, the least troubling to the
Hmm.
client, right? So one of my observations is that, in a rapid resolution therapy session, and again, if you go to the website, you'll be able to see this in play because there are a number of cases on there done by the developer of rapid resolution therapy. And um, you can have somebody talking through a horrific gang rape and laughing through it as they're
Hmm.
processing the memory. So it's lighthearted. Um, the dangers of re-traumatizing somebody are, really minimized. In fact, I think they just don't exist with rapid resolution therapy because the therapist or the facilitator of the process is very much guiding how it goes. Um, so, I mean, I'm trained in it. I really enjoy it. But the reason I really enjoy it is because it's so effective. And, many of the people that come to, or at least I've been in trainings with, have come to rapid resolution therapy because they've been thoroughly burned out with the methods that they were using, right? So we've been doing things like talk about therapy for 20, 15 years and process it that way. So talk therapies over a long
Hmm.
time. And so my colleagues who do rapid resolution therapy, many of them will be like, oh, I was doing that and I was getting really tired and burned out and it's time to retire. And then find this powerful way of working that not only uplifts a client in a few sessions. Like I like personally to work in 90-minute blocks. So I say to clients, I see people 3 to 5 times, but there are RT therapists who will work with you for a half day or a full day, and then it's really a one session situation.
Right.
And so to work that way and to see a change is uplifting for both the client and the clinician. So most people talk to me and they hear what I do and they're saying, oh, that must be a very difficult way that must be a very difficult thing to do. How do you stop yourself from burning out? And yet the reality is that because of this way of working, I feel good at the end of the session and the client feels good at the end of the session. And it's so it's very different. It's hard to
Hmm.
communicate just how beautifully it works and how effectively it can and quickly it can affect change. But it's been I've really enjoyed and will continue to work in it for a long time. But again, there are other modalities, similar approaches in terms of let's find the memory and update it while we can, you know, while it's malleable, and then it can be stored without the charged experience.
Yes. And it's important that people keep exploring it, people who
Mhm,
are on the side of mental health and who are clinicians and researchers, that we keep exploring tools and ways and approaches
mhm,
for healing,
mhm,
because like you said, and where I come from my background in psychology, I didn't want to go forward as a clinician.
mhm,
I didn't continue my education at the higher levels because at least what was presented to me,
mhm,
just didn't quite fit my personality and my
Mhm.
expression in life.
Mhm.
And I was probably just given a very narrow view of like,
Mhm.
this is clinical,
Mhm. Mhm.
psychotherapy, and this is what it looks
Mhm.
like. And yes, there are
Mhm.
different theories, but essentially, like, the environment you're sitting in all day working is kind of the same.
Yeah.
It's just like,
Yeah. Yeah.
oh, no, not for me. But to know that even since that point in time, which was 20
Mhm.
years ago, 20 some years ago now, that there have been new developments.
Mhm.
When was it offered? Like, when was it
Oh,
created?
um I don't know the date. I mean, I'm sure that it's been being used for more than 30 to 40 years
Oh,
now, if
okay.
not longer. I just started working with it in 2011, 2012 myself, but I think it had been
Right.
going on for a long time before that.
Okay.
I will say, and I just want to take the opportunity that there are modalities that I feel like can be extremely dangerous, and
Mm,
those are out there too. And those would be the ones where, the client or the person who's having the disturbance is encouraged to think of themselves as broken, right? So
mm.
there are modalities where people, you can go to a training and they'll say, well, you see this piece of paper and they'll tear it in a few pieces and they'll show it to you and
Oh
they'll
my.
say, this is what happens when you've experienced sexual violence.
Oh
Now,
my.
that's not helpful, especially if someone
No.
has had that experience, is feeling shameful about it, and then is being met with a lens where they're broken and something needs to be fixed. That I consider, a dangerous way of working.
Seems to be.
Yeah,
Yeah.
yeah,
So maybe someone had, good intentions with creating that approach, but yeah, my instinct is
yeah, yeah,
no.
yeah,
No,
yeah,
that's not helpful.
yeah.
I agree. That is interesting. Well, is there anything that you want to share, words of wisdom, encouragement for people who are facing trauma, who are experiencing shame because of trauma, and whether they go down the path of the rapid therapy or somewhere
Mhm.
else or not at all? Is there anything just as a general takeaway you'd like people to know or think about possibly their shame and trauma?
So, one of the things I think that encourages shame to grow or to stick around is secrecy.
Mm,
So, holding this secret just allows it to circle in and get deeper and darker. So, reaching out, sharing your story, um, reaching out to a professional also with the view to share that story can really you know lessen the burden of shame, because once a light is shed on something, it's less of a secret. So connection with someone, caring family, caring friends, or um, someone who can support you professionally would be something that I would do. And then also to consider that one is never broken, right?
mm,
There it has become common in our language to think about, what has happened can break us, or that people are broken. But, my view is that the powerful spiritual beings that we are cannot be broken. We can have difficult experiences and our bodies can be hurt. And our thoughts can be confused, but the core of who we are, the essence of who we are, is never touched, never broken. So that would be something that I would encourage people to explore as a way of thinking about themselves.
it's beautifully said and so very true in my opinion as well. And that is what I hope to offer here through my podcast and in other arenas, is the idea that even if you are shameful and you've maybe lived with shame for a long time about an
Mhm,
experience,
mhm.
it doesn't define you. It really doesn't. And you can move
Yeah.
forward from it. I mean,
Mhm,
it can take time and it can be not painful, but it can be a heavy process, but it's worth it. But I also too think that when people don't feel judged.
Mhm.
And I mean like real talk, when they really think and feel and believe that whoever they're working with or whoever is in their lives
Mhm.
as emotional support doesn't judge them, but expects them to be, accountable for their lives, but doesn't judge, then really there's so much freedom a person can experience in knowing that they can move forward, even if it takes work and time. It's worth it, and you don't have to feel that is that experience, or anything negative that you're holding on to doesn't have to define who you are as a person. Harder to do than just to think it, but it's, to your point, there's truth to that. Your mind and your body can go through something, but the human spirit is forever strong and evolving and
Mhm.
progressing, as long as it is connected to something that is
Mhm.
a source where they don't feel judged in like little ways and in big, the big scale of life. So it's really powerful, Katso, but I really appreciate you sharing the work you do. It's so important, and I'm glad to know that you are, one of many people out there who are able to help people through some really hard experiences in life. But there's a tool,
Yeah.
there's a resource that
Mhm. Yes, yes, and
can get them through.
yes,
There are results you've seen, of course,
yes,
and so
yes,
that's
yes.
that's very hopeful.
Yeah, no, and thank you for having me and talking about these important topics. Like I would very much want to say that if you are struggling with shame or trauma, if you find a RRT, rapid resolution therapist near you, they will have the tools to help you move through it painlessly and rapidly. And that's a lot of hope for a lot of people, I think.
Yes. The operative word being rapid in our world,
Yes,
especially when people are
yes,
busy and
yes,
they've
yes,
they've got so many things to do and they still want to do in life. And that's an important keyword there. Rapid.
yeah, yeah.
Doesn't have to
And
take years and years and years.
most of my work actually comes from other therapists referring clients to me, and that's
Mm,
one of the things that therapists observe, which is that wow, that was pretty fast to get
wow.
through that. So it definitely is. And I mean, it does sound a little too good to be true, but if you find a good RRT therapist near you, or call the office and have them recommend somebody to work with you, you definitely will find that you do experience some change.
Amazing. Well, as I always do at the end of the podcast, I ask my guest, Katso, which television show, new or old, do you recommend and why?
So I do not watch TV.
Okay. Never have, really? Or, I mean,
As
much?
a child
Mm,
growing up, so I don't know that I can recommend any of that. Like growing up in Kenya,
mm,
you know, yeah, a long time ago.
right.
But I am very fond of romantic comedies. So
Mm,
those are something I do watch on Netflix, and it's a nice way to decompress at the end of the day or the weekend. So big
yes.
fan.
Okay. Is there one in particular that you've watched recently that you thought was
Mm,
good quality?
oh, I'm trying to think.
Put you on the spot.
I
Well,
know.
I think that romantic comedies are also evolving, like what they look like, and
Hmm.
the formula of
Hmm.
what they're about isn't
Hmm.
exactly the way it used to be, which is refreshing.
This is true. No, I enjoy them, and I'm enjoying also seeing sort of more, more diversity in that
Mm.
genre. You know,
Oh,
it's nice
yes.
to see.
Yes. Very cool. Well, Katso, again, thank you so much for taking time to chat with me and sharing about what you do and who you are. And it's been educational and it's been inspiring. I hope that all of those who are listening and watching know that there's yet another, but also very effective resource and tool for dealing with trauma and moving past shame. So thank you again.
Thank you. Thank you so much for having me.